The adrenal glands sit right on top of the kidneys, like so. This is the kidney, and this is an adrenal gland. So we have one on top of each kidney, and they have two different sections. Each adrenal gland has an inner component that's called the medulla, and an outer component which is called the cortex. And kind of similar to the pituitary gland, these two different components are made from different embryonic tissues, derived from different embryonic tissues, so they behave a little bit differently. They have different roles. The cortex, the outer portion of the adrenal glands, is epithelium, and it secretes stress hormones, essentially. The inner medulla is neural tissue, and it secretes epinephrine and norepinephrine. So we've seen these before. These were neurotransmitters back when we were talking about the autonomic nervous system. We're going to see these molecules again now, and they're going to behave as hormones instead of neurotransmitters. So the adrenal medulla will start on the inside. Again, it secretes epinephrine, norepinephrine. And in terms of what these molecules do, once they're secreted and they're in the bloodstream, they have very similar effects, similar to what we've seen with the autonomic nervous system. It's the same molecule. It's going to do pretty much the same thing. However, acting as a hormone, the response is going to last longer than if it was being used as a neurotransmitter. Neurotransmitters get taken back up or degraded very quickly. Hormones are in circulation in the blood, so their effects tend to last a little bit longer, up to about 10 times longer. So what these do, these help to increase things like respiration rate, cardiac output, mental alertness, metabolic rates, so the rate at which you're using energy. All of that gets increased in response to these hormones, epinephrine and norepinephrine. The adrenal cortex, moving on to the outside of the adrenal glands, the cortex secretes steroid hormones. All of them are derived from cholesterol, and collectively they're referred to as corticosteroids. So cortico, this is referring to the cortex of the adrenal gland. Corticosteroids, they are steroid molecules. And corticosteroids have a few different roles. The one that probably we're familiar with the most or gets talked about the most is the stress response. Cortisol is our stress hormone. Cortisol is a corticosteroid. But there are a couple of other important roles that corticosteroids do as well. They help maintain the mineral balance, so, sodium and potassium ions. We know how important those are in terms of the nervous system just being able to function normally. So corticosteroids help to maintain that mineral balance correctly. And then they also help regulate the rate at which we process glucose and use glucose, so glucose metabolism, and of course that's a very important role as well. We're going to focus in on the stress response for just a minute. So cortisol, this is something that's secreted by the adrenal cortex. And there's an interesting tie-in with cortisol and the brain. So if you'll recall back when we were talking about the brain and the nervous system, there are certain regions of the brain that have receptors for cortisol. And so when we are stressed, when we experience stress, that does influence what the brain is doing. One of the ways that it influences what the brain is doing is through the action of the anterior pituitary, which we just talked about in the last section. So anytime that you are undergoing perceived stress, and this is kind of an important word, so you perceive it, you're aware of it, your brain knows about it. If you have a perceived stress, what that will do is cause the hypothalamus to make the anterior pituitary secrete more adrenocorticotropic hormone. And that hormone is going to circulate to the adrenal glands, and the adrenal cortex will become more active, so it'll increase the production of cortisol and other glucocorticoids. So cortisol levels increase in response to perceived stress. This can be a very good thing in the short term. This is what allows us to properly recover from events like surgery or trauma of some sort or illness. This is a good thing because it's inhibiting, right here's where this is talked about, it's inhibiting the immune system just a little bit. So that's a good thing because it makes the immune system not over-respond to those short-term events that you're trying to recover from. If the immune system over-responds, then you might end up in a more serious way because your own immune system might be attacking certain things that are going on in your body. So that's good in the short term, to suppress the immune system in those cases. In the long term, so this would be talking about more like chronic stress, this is not a good thing. In the long term, this can be very unhealthy for multiple reasons. So for one, just suppressing the immune system long term, you can imagine, well, that's not going to be good. We have an immune system for a reason, and if you suppress it for too long, then there might be infections or other problems that just sort of go unaddressed in the body. So that's not good. But this can also lead to other issues, like even the development of diabetes, or it can make diabetes more difficult to manage. And it can also cause different sort of symptoms. So cortisol can also contribute, I think we mentioned these in the last chapter, it can contribute to memory loss. So the hippocampus doesn't do quite as good of a job of processing memories at night. But also anxiety and depression can result. So long-term stress, we all know long-term stress is not good. Here are some of the specifics of what it's doing. It's through the action of cortisol that these things happen. So this is kind of an ironic time to be lecturing on stress. I think probably for many people the last week has probably been pretty up there in terms of stress levels, but it is important to keep things in perspective. I hope that you can be enjoying your unexpected time at home. If you're not enjoying your time at home, maybe you can at least keep in mind that it is temporary, and even if you're not enjoying it, maybe you can be making good use of the time for I don't know, things that maybe you weren't able to address before. So anyway, that's it for right now in terms of physiology on the stress response. Oh, by the way, I wanted to say one other thing. So sometimes there are drug treatments that can be given that sort of make use of this system. So glucocorticoids can be given exogenously, so in a drug form, to treat various conditions. And just to give a couple of examples of that, so Hydrocortisone Cream, this is sold over the counter. Hydrocortisone it's cortisol is what it is, and it can be applied to the skin. It's an anti-itch treatment, so if you have an itchy patch or if you have eczema that is mild, a lot of times just using hydrocortisone over the counter can help to suppress that. And all it's doing is inhibiting inflammation. So it's preventing, again, the immune system. It's inhibiting the immune system just a little bit. So this can be a very useful thing. This is also good for after a transplant, to helping the body to not reject the new organ that's been transplanted in. Glucocorticoids are very good for doing that. So these can be very effective drug treatments in different situations.